Well, the Medicare Advantage companies are at it again. Unfortunately, UnitedHealthcare just announced, due to their poor earnings for 2025, that they anticipate removing 600,000 Medicare Advantage members during this year's annual election period, which runs from October 15th through December 7th. I'm going to show you this article that I'm referring to here. UnitedHealthcare said in its second quarter earnings call that it plans to drop Medicare Advantage plans that currently serve over 600,000 users, becoming the latest health insurer to announce a scaling back of this magnitude. This is a quote from their CEO, Tim Knoll. "We are seeing higher than expected medical cost increases, particularly in outpatient care. The American health system's long-standing cost problem is accelerating. Medicare Advantage has been extremely profitable for most insurers for a very long time, but in recent years, insurers have complained about people using more healthcare services than they anticipated and rising healthcare costs across the board. It's bad for a plan's business when people use healthcare from a plan that offers healthcare coverage. That said, it appears that they're trimming around the edges and not pulling out of areas altogether." So what does this all mean? Over the last 2 or 3 years, the reimbursement rate that Medicare Advantage companies receive from the federal government has not been keeping up with what they call the medical loss ratio. Basically, what that means is the amount of money that they're paying out in claims is more than they're receiving reimbursement from CMS, which is the Medicare and Medicaid services. So the way that a Medicare Advantage plan responds to financial loss is that they're going to do a few things. They're either going to trim their medical provider network. That means remove doctors and hospitals from their network that are not profitable enough, or they'll actually remove plans from certain counties, and you'll receive a letter in the mail that says your UnitedHealthcare plan will not renew for the 2026 year. You'll have to go to the marketplace and find another option. So this is becoming very common. We saw over 1 million people during last year's annual election period lose their plan from UnitedHealthcare, from Humana, and from Aetna. So this reimbursement rate has been a real problem. Depending on the administration and how well they like Medicare Advantage is going to determine how high the reimbursement rate is back to the company. So this year, it looks like it's going to be somewhat of a repeat of last year, where a lot of people are going to lose their plans. Some of the benefits are going to change, and a lot of people are most likely going to lose access to different medical facilities and doctors as they try to trim costs there as well. So here's my recommendation. I've been doing this for 15 years. I've been in the Medicare space, educating people, teaching people how Medicare works, helping them understand how Medicare Supplement works compared to Medicare Advantage. The bottom line is Medicare Advantage is built on very shaky ground. There are many moving parts. They have to receive an adequate amount of reimbursement from the government. They attract all of these new members by giving them dental and vision and free rides to the doctor and grocery benefits. Those things are all really great. But what's happening is that people are being lured to these zero premium Medicare Advantage plans and all the free benefits they get with them. And now they've taken on so many new baby boomers and so much new risk that they don't know how to handle it anymore. So what they're doing is they're learning how to handle it. Once they get all of these new people in, then all the claims start to come through, and then they determine, are we making money? Are we losing money? But they won't know if they've made a good decision on attracting all these people until they get into the system and start using the plan and driving up medical costs. So this is just an informative video to let you know that if you do have UnitedHealthcare, we don't know what areas will be affected yet. This is probably going to happen with Humana as well. So as I did last year, I'm doing the same this year. Keep an eye out on your mail. You do get your annual notice of change during October usually, sometimes a little bit sooner. See if your plan's going to renew. See if it's going to terminate. That letter will indicate what you need to do. If you have questions, you know how to reach out to us, comment below or call us. But this is another very stark warning to people. definitely look at a Medicare supplement plan. You will not experience these plans being canceled, delayed care, prior authorizations, network changes, referrals. You will not be balance billed or denied claims. Original Medicare with Medicare supplement is far superior. And quite honestly, it becomes frustrating seeing how many people fall for these zero premium plans, and then they get into a place of trouble. They're losing their plan, they're losing their provider. So I would highly recommend, if you can afford Medicare supplement, definitely do your homework. Contact us. We can help you determine that. Contact a reputable agent. Figure out if you can afford Medicare supplement. Get on it. Get on superior coverage. Stop dealing with all of these annual plan change roller coaster rides and plan terminations. Get on a plan that's comprehensive like Medigap, and you will not regret it. Thanks for watching. If you have questions, let us know if we can help. For now, take care.